Hi, this is Eric Ruderman coming to you from Chicago, Illinois for Room Now. And I wanted to take a few minutes to talk about the psoriatic arthritis or psoriatic disease clinic that we've run for a number of years at Northwestern. I think the impetus for this is that we now have more than a dozen different biologic and targeted small molecule treatments for psoriatic disease. Many of these are actually more effective for skin than for joints, but as rheumatologists, we cannot just focus on joints. We have to consider all aspects of disease in our patients, including their skin. And in fact, the GRAPPA guidelines, which I think are a really useful framework to think about treatments, uh, take this into account, and they look at the different manifestations of disease and decide, or at least sort of recommend which therapies are more appropriate for which aspects of disease that an individual patient may have. And with that in mind, we actually started our joint clinic at Northwestern a number of years ago, shortly after I arrived at Northwestern almost 20 years ago. And it's been an incredible success. And, I've long worked with dermatologists in managing our patients with psoriatic disease. But at the time, the idea of sort of doing it in a single clinic space was really pretty novel. And it was an exciting prospect for us. And I got to tell you, over the years, it's really become my favorite clinic session of each week. I really enjoy the time that I spend there, both with my dermatology colleagues and with the patients, who I think also really enjoy it. And I think what one of the real benefits to doing it this way has been that we truly are able to work with shared decision making, and that's not just a buzzword. I mean, that's really the approach that we take to managing these patients. And then when we make treatment decisions, it's really a fascinating three-way conversation between myself as the rheumatologist, the dermatologist, and the patient. And we can do this in real time, which is really fun. And I think the patients really appreciate that because they recognize that we're really working at this together to try to address all aspects of their disease. It also takes them out of the role of being the middleman. They don't have to go back and forth and shuttle messages from their dermatologist to their rheumatologist. My dermatologist said this, should we do that? And then they go back to the dermatologist and they say the rheumatologist recommended this. And we can communicate offline with dermatology, and that's helpful. But it's really nice to be able to have a very detailed conversation in real time to identify how to focus their therapy. And I think it's become particularly important in recent years as the concept of treat to target has moved into the psoriatic arthritis realm. We've been doing that in rheumatoid arthritis for a while. And in psoriatic arthritis, the unique aspect is that we need to look at all aspects of disease, that the target is not just control of joint disease, but a skin disease or enthesitis or nail disease. And patients frequently have their own opinions about which symptoms or which manifestations have the greatest impact on their lives. And it's really important to respect that. And those are the kinds of issues that come up as the three of us talk about treatment. It's also been a really great learning opportunity for me. Not as a non-dermatologist, I know a bit about what they use and I can read their trials, but it's really great to sort of talk to the dermatologists in real time to understand, what their experience has been and what the pluses and minuses and the sort of unique aspects of each therapy are as we make choices in combination with the patient. I get it that this is really a luxury. I'm in an academic center and I have the ability to sort of put together a shared clinic because we have a shared infrastructure and an electronic medical record that we use together. Even with that, we still have our own challenges. One of the things we learned early on is that a dermatology practice is not a rheumatology practice. And, they run patients through much more quickly than we do. I can't effectively manage a complicated patient in a 10-minute office visit. On the other hand, I think it's been an interesting learning experience for me because I've been able to learn to really focus what I'm doing and we'll do a new patient visit in 20 minutes or so, and it gives me a chance to really focus on the issues at hand that day. It's sometimes a little frustrating because I don't always feel that I know everything I need to know about that patient. Sort of used to that as internists and as rheumatologists. But a lot of that information is stuff that we glean along the way, recognizing that we're not making a decision at a single point in time, but we're going to be managing and working with these patients for a long time to come. And so a lot of those things can come up later. I can see in a private practice setting, it might be very challenging to set up a combined clinic like that, like we have. Certainly the infrastructure is going to get in the way because of how clinics are set up and where the costs go. I wonder whether it might be done virtually to a certain extent. I mean, we have really sort of moved into telemedicine in the last couple of years with this pandemic. And, is there a way to work with a dermatologist so that the dermatologist is videoed in for a telemedicine visit with the rheumatologist and the patient in the same room, or vice versa? And we could video in with the dermatologist and the patient in the room. Not exactly the same, but there may be a way to sort of bounce back and forth with those kind of visits that still brings the three of us together. I don't know the answers, and I think that there are a lot of possibilities. All I can tell you is that this clinic has been an incredibly rewarding experience for us as providers and for our patients. And I would really encourage practicing rheumatologists out there to look into ways in which that, for those who have an interest in psoriatic disease, to look into ways that you could bring something like that, like what we've done, to your patients. I think the patients really would appreciate it, and I think you'd find it incredibly rewarding. And with that, I thank you for your time, and would like to suggest that there are a lot of other great videos here on Room Now in Psoriatic Disease Month.